In the recovery room right after surgery, our dedicated nursing staff at the Precision Surgery Center will make sure that the patient is comfortable. The patients will be discharged from the surgery center with a walker. We do believe that it is safest initially for the knee replacement patients to utilize a walker until they're very steady on their feet. I call all the patients the evening of surgery to check in on them, and we typically do have significant contact with them back and forth just to make sure everything is going well and smoothly for them. Then we have a service come and work with the patient for several visits prior to their first postoperative visit with me. So we see our patients regularly after partial or total knee replacement. The initial visit is typically at the 2-week mark, just to check their wound and take a postoperative x-ray and make sure that they're recovering well. We typically see them next 6 weeks after surgery to assess their range of motion and again ensure that they're healing well. We'll see them again at the 3-month mark after surgery to take a second postoperative x-ray and to assess their progress. And then we also typically see them 6 months after the surgery and then at the 1-year mark. There's no brace required. It's a simple stocking type dressing, and they leave that in place until they see us at the 2-week mark after surgery. Typically, patients can return to driving in approximately 2 weeks. That's about the fastest they can do it. Most typically for patients with a desk job, the earliest they could return to work is around the 2-week mark. I would say a conservative estimate for full return to work for most patients is approximately 6 weeks after surgery. There is a risk of blood clot after knee replacement, so we do recommend that patients take 2 baby aspirin every day for the first 6 weeks after their knee replacement. And in that window, we typically prefer that the patients not fly unless it's an absolute necessity. After the 6-week mark, the patients are free to fly as they so choose. So patients always ask about sport, and truly we want them to be able to get back to activity, because oftentimes the purpose of them having a partial or total knee replacement is to allow them to lead the athletic lifestyle that they're looking for. So we certainly do want them to return to sport. We don't want them to do that too quickly because we want it to be safe and appropriate. I have many patients who are golfers, and typically the patients who golf will get back at the driving range and just start to pitch and putt around the 6-week to 2-month mark after surgery, and then they can progress from there. The Smith & Nephew Journey 2 BCS knee replacement, specifically featuring their Oxinium technology, was designed using the latest in human simulation software and built using some of the most wear-resistant materials available. So we're hopeful with the Smith & Nephew technology that our patients may be able to achieve the longest lifespan possible.